The data are indeed more limited compared to chemotherapy, and it's also a different context. So, for example, when you consider monoclonal antibodies, which are often part of immune therapy, actually the first 12 to 14 weeks, there is no transfer of immunoglobulins through the placenta. So at that time, you can give it safely, actually, during the first trimester. But you see that the transfer increases when the pregnancy is growing. So for immune therapy, not for all immune therapies, but for monoclonal antibodies, actually you can give it safely during the first and the second trimester. But we actually advise not to give it from the 32nd week on, because we know it can pass the placenta, and there are some reports of pregnant patients who received checkpoint inhibition during the pregnancy, in which the baby afterwards develops an autoimmune complication. So it's very important that it's to knowledge that it's actually different compared to chemotherapy, where you never give it during the first trimester. Actually, for the monoclonal antibody, it's important not to give it at the end of the pregnancy, or if you need to give it, to be very careful.